Hello, everyone. Good evening. My name is Miss Rahila Sunday, and welcome to another episode of Learning Special Needs. And I hope we have a good time today. Yeah, so today we're going to be talking about the 13 categories of disabilities under the IDE. Okay. So today's topic is understanding the 13 categories of disabilities under IDE. I'm sure you'll be wondering what is IDE. So the full meaning of IDE is Individuals with Disabilities Education Act. It's actually it's a federal law in the United States, but in Nigeria here we use it too. And it actually helps because we have so many categories in learning in special needs that is not only limited to the ones that we know which are most common, which is the autism, the dyslexia, the ADHD, and all those. There are other ones, and most of the other learning disabilities, most people not categorize it under learning disability. We not even know it as part of learning disabilities because it sounds outside. But the IDE included it into the learning disability. And we did, just like last time we talked about the types of learners. Under this, if you know the categories of learning disability, we now understand how we can help our learners, help individuals who are living with these disabilities to cope, to manage, and also to know what intervention to use for them. So, yes. So the Individual with Disability Education Act, that's the IDE, is a federal law in the United States that ensures all children with disabilities are entitled to a free, appropriate public education. Okay, yes. Please, if you can't hear me, let me know so that I'll know that, okay, we are all hearing. And at the end of the class, please, let's feel free to ask our questions. So I'm going to mention the different categories because our time is actually fast spent. I don't want to waste time. So our time is actually fast spent. So I'm going to be mentioning the different categories. And I will not really go into details. And as I mentioned them, I'm not going to mention them accordingly. I'm just going to mention them randomly, like they are not arranged. So I'm going to mention them. So understanding these categories helps educators, parents, and professionals provide appropriate support, intervention, and inclusion for learners with these diverse needs. So just like I said earlier, when we understand these categories, it will be easier for us educators. You could be a parent, you could be just the general public who is interested in helping people who have one disability or the other, that you have the passion for it, or you've seen it around you and you'll be like, oh God, what can I do to help this person? Maybe you are an educator in the classroom and you have a learner in your class who you suspect or you know has one disability and you want to help. So this will help the IDE. And it's not just this. I'm just going to be talking on the surface. If after this class you can go ahead, read more on it. There's a lot to learn from it. So after this class, feel free, if you want the note, you can send it to you. Okay, yes. So the first category is specific learning disability. Under this specific learning disability, we are actually it's under this specific learning disability is it's very common because we've heard of it's under this learning disability. We have dyslexia, we have dysgraphia, we have dyscalculia, and the rest. So when we hear dyslexia, okay, dyslexia is basically it's what you call it's what's the word to use? It's one of the main specific learning disability that we are all common with. Because when anybody hears anything about learning disability, what comes to anybody's mind is learning disability, because dyslexia has to do with difficulties with reading, spelling, recognizing word or decoding words. So yes, so dyslexia is part of this category. So the specific learning disability is a disorder in one or more of the basic psychological processes involved in understanding or using spoken or written language. It affects the ability to listen, think, speak, read, write, spell, or do mathematical calculations. So when it comes to the mathematical calculation, it's actually called dyscalculia. So dyslexia is difficulties with reading, spelling, and recognizing words. And dyscalculia is struggling with mathematical concepts and problem solving. So when you have a child in your class who you notice is struggling with reading, with literacy, English, that child is the child is not dumb, the child is not lazy, the child is simply having difficulties decoding words. And we have teaching methods that can help such individuals, and they are brilliant. Believe me, that the people with dyslexia, they are brilliant, very smart. If they finally get to know how to read, the basics of reading, the understanding basics of literacy, they are brilliant and are smart. You as the educator, you'll be amazed on what these children can do. As parents, when we have children we notice, or when you have a child whom you notice that this child at this age, you should have started reading at this time. You should know how to read at least 2 letter words, you should know how to read 3 letter words, and yet the child is unable to even identify basic alphabets. Please take the child for, as a parent, as educators, take the child for a proper diagnosis in order to know whether the child actually has dyslexia. Because another disclaimer is that you can't just label a child that a child has dyslexia or an individual has dyslexia if that person or that learner has not been diagnosed. There has to be a diagnosis for any kind of learning disability before you can say that, okay, this child or this individual or this person has a specific learning disability, or this person has a learning disability. Even we as a special need educator have been taught several times on no account, even if the child is in our class, we don't just assume that this child has dyslexia until the child's diagnosis has been provided and we've confirmed. But are we going to teach that child? Of course, we are going to teach that child as and break it down to the child as possible. Literacy, numeracy, whatever we are going to teach the child, we break it as possible, break it down as possible so that the child can understand. But we don't label that child. We can't say, okay, this child has dyslexia, this child has dyscalculia. We don't have the proof for it, so we can't label the child. So that's just a disclaimer I want to put out there, so that you don't go into an environment and then you just see a child, or maybe you are in a school and you see a child struggling to read, to write, or struggling to understand mathematics, and you'll be like, this child has dyslexia, this child has dyscalculia. It's no, we don't do that. It's not appropriate. It's so just to lay it out there. So let me not divert. Let me come back to the lesson I was teaching. So dyslexia, and dyscalculia, struggling with mathematical concepts and problem solving. So people who are diagnosed with dyscalculia, they actually they find it difficult to understand mathematical concepts. For example, numbers, anything that has to do with numbers, it tends to be like a lot in their brain. It's confusing to them, to the learner or to the individual. So in a class, we could have individuals or learners who understand mathematical concepts very easily. And then when it comes to a particular learner, this learner is not picking up. You've explained this mathematical concept, you've explained, and then the child is not getting it, or the learner is just not getting it. And then as teachers, it can be frustrating by the time you teach a child, especially if you don't know that this child has a disability. It can be frustrating, and you can you out of frustration, you can call in a teacher can begin to call the child names, such as, you're such a dumb head, you don't know anything, your mates are there learning, and then you cannot learn. How many times do I have to explain this to you? These words can be very hurtful to that child, and whatever progress that child is trying to make, or whatever progress that child has made in such um in whatever the child was trying to learn, or any mathematical problem the child has been trying to make progress in, you see that progress will begin to withdraw, because the child has put in effort. It's actually frustrating for the child too. It's frustrating for the learner too. It's not just you as a teacher. As you are frustrated, the child is even more frustrated and blaming themselves. So as educators, even if there are no diagnosis showing that this child has a specific learning disability, or this child has dyscalculia, it's important that we are mindful of the kind of words that we use when we are frustrated in teaching our learners. Being more loving, being more caring actually helps, and it helps the child to actually open up and want to put in more effort in learning. So when we, as educators, as parents, as general public, you could just be you probably don't have anybody who has special needs in your household, but you want to just know, just in case you come in contact, or one day you just find yourself in such an environment, you will know what to do. Okay, this person is finding it difficult. There are methods in teaching these things. There are different methods. You can make the mathematical calculation very easy, more fun for such a learner. And because our time is fast spent, I'm not going to discuss on all the specific learning disabilities. I'm going to number two now. Number two is other health impairments, short for OHI, other health impairments. Other health impairment is a condition that limits a child's strength, energy, or alertness, whether due to chronic or acute health problems. So in this category, we have ADHD, we have ADD. ADHD stands for Attention Deficit Hyperactivity Disorder. This learning disability affects the individual or a learner's concentration. The child is always impulsive, disorganized. Some are disorganized, some it depends on the how severe the special need is. And then under it, we have under the other health impairment, we also have epilepsy. That's why from the beginning I said that there are some of the learning disabilities that are under this category of IDA, that when you hear them, you'll be like, are you sure this is part of the learning disability? Yes, epilepsy is part of it. And then there's sickle cell anemia. Yes, it's also part of it. And there's asthma, there's diabetes, and so on and so forth. There are still more, but these are just like the ones that I want to share here. Okay, so for ADHD, a learner who has ADHD in a classroom you find it very difficult to control such a learner. For example, if the learner is meant to sit while their mate is sitting and learning, that learner may not be able to sit in one place. It's not their fault. It's not because they are disobedient. It's not because they don't want to sit in one place. They can't just help it. You know how someone can be restless? That's how it is for them. They just want to move. They want to be active. So for such learners, it's important that their learning involves more of action activities, so that to keep them moving, so that they don't just sit in one place. They get bored easily. So they have to their learning activities has to do with something that will help them move about, sit a little bit, then move about again, then just I will actually say it should be more of like play and work, play and work. So play and work is we learn a little, then we play a little. We learn a little, then we play a little. So that's how it works. So for a child who has ADHD, such a child um will be able to sit for a short period of time, and they need special attention, because you need to pay special attention to them, because a child can be here this moment, a learner can be here this moment, and before you know what's happening, the child has reached another classroom, or if the gate is closed, the child has reached the gate, and you'll be wondering, when did this child leave here? Okay, so yes, it's not their fault, it's called ADHD. And as I've said before, it has to be with a diagnosis. You cannot just because a child is hyperactive, the child, as layman will say, the child doesn't stay in one place. You now assume, this child has ADHD. Okay, no, we as educators, as professionals, we don't just assume. We have to have the evidence. There has to be an assessment, there has to be an evaluation, there has to be a diagnosis that's showing that this particular person is has this. And then epilepsy, it's a seizure disorder that may disrupt learning. Okay, I don't know if we've seen someone who has epilepsy. It can be frightening when the seizure starts. And I had one in school when I was in school. And most of the time, whenever the seizure starts, they actually tell us that we should not touch the person, that we should just allow the person to for the seizure to end to be over before we can now assist, because it has it's when the seizure starts, it's important that we clear the area, make sure that nothing is on the way. That's why for people who have such disorders, it's important that their environment shouldn't have sharp objects, because it's something that just comes. They don't expect it. So the environment should be accommodating, it should be safe friendly. It shouldn't have sharp objects or things that you know that when the seizure starts and maybe they mistakenly hit their head or something, they can injure themselves. So the environment should be safe. Okay, so I'm going to move to the third category. The third category is autism spectrum disorder, short for ASD. So most of the disabilities that we know, as I've said before, is once we hear any learning disability, most people think it's just dyslexia, it's just autism, it's just okay, AD. It's not that ADHD is coming out, yeah, but most people just assumed any special needs or disability, it has to be autism. In fact, most people don't even go for dyslexia, because I've had several times where people ask me, what do you do? And I'll be like, oh, I'm a special educator. And they'll be like, oh, you teach children with autism? I'll be like, it's more than that. There are other ones, but yes, I do. So the third one is autism spectrum disorder. So it's a neurodevelopmental disability or disorder that affects an individual's verbal communication, social interaction, and may even include their repetitive behavior or resistance to change. So if you notice, or if you've come in contact with people who have autism, they love routines. Like their routines has to be in play. If they get used to a specific routine, we don't you don't just change their routine without informing them. It's something that they've built over time, and changing such a routine can actually disrupt their mental space. Let me use that word. So for people who have autism, they love routines. So by 1 o'clock, it's time for lunch. 1 o'clock has to be time for lunch. You can't say 1:30, 1:01. It has to be that 1 o'clock, 12 o'clock. So there's time attached to everything. It's it's funny how they just get used to the routine, because in my class, our time for lunch is early, not early morning, late afternoon. So once it's getting to that particular period of time, you see them going to carry their bags. We didn't tell them that it's time for lunch or it's time for breakfast. They just know, because they are used to the routine. This is something that as they came into the class, they got introduced to. So it's now part of them. They know that, okay, time for this, time for the after circle time is lunch. After circle time is breakfast. So after that circle time, that's why we don't just change the routines because this particular day rain is falling, so we'll not go for, there's no circle time or there's no outdoor. So it has, even if rain is falling, whatever happens, that routine has to stick. Okay, another one, another signs that you know that someone has autism is that they love repetition. So you see flapping of the hands, or a fan can just be rotating, and they sit or they stand and keep on staring at that fan, spinning round and round. Okay, yes. So anything that has to do with repetition, any action that like spinning around, or blabbing the same word or saying the same word, yes, or saying the same word, it can actually, yes, that's part of autism. So other examples of um, autism spectrum disorder, we have the signs, that's their symptoms. We have limited eye contact, difficulty with conversation, engaging in repetitive movement, that's hand flapping, sensory activity to sounds. So most individuals who have autism, they are very sensitive to sounds. So any little noise can affect them. The reason being is that the sound is more amplified in their ears than it is normal to us. I have a student, when he's talking, he basically whispers, and you'll be wondering, why is this learner whispering? If you don't know, you will think he doesn't want to speak out loud. To him, that whispering that he's whispering is actually loud to him. So if me, as his teacher, I'm talking normally, he'll think I'm shouting, because what I'm saying, and because I'm using a normal tone to talk to him, it's more amplified. So he hears it as shout, as noise. So for such people, when you want to talk to them, you talk to them in a calm tone. They hear you. It's you will think that, okay, if I don't talk out loud, they will not hear me. They hear you clearly. For people who have sensory for people who are sensitive to sounds, even with most some are sensitive to light or textures. Okay, number 4, emotional disturbance. Please, if you can't hear me, you can signify by telling me that you can't hear me. But since I know anything, I'll just assume that everybody's following and hearing. So number 4, emotional disturbance. Emotional disturbance, this is a condition that affects emotional or behavior functioning. Example is such as anxiety disorder, excessive fear, panic attacks, depression, lack of emotion, lack of motivation, schizophrenia, we have hallucination, diagnosed disorganized thinking. All these are examples of emotional disturbance. So just like I've said earlier, most of the learning disabilities that we're going to see here, we, most people will not include it as part of learning disability, because when you hear anxiety disorder, you'll be like, how does anxiety disorder affect a learner? Okay, for someone who has excessive fear, who have panic attacks, it's actually going to affect how that learner learns in the classroom. There are people who are scared of every little thing, that even to go outside, it's very hard. There are people who basically stay indoors. It could be as part of as part of trauma, what happened in the past, or something happened and they just decided to just lock themselves up inside. But that's something that can also affect their learning and their daily livelihood, because not just learning, for someone who has excessive fear, the person will not be able to function as is supposed to in the society. Depression, for people who are depressed, most people take antidepressants for this kind of thing, so it actually affects a learner or an individual when it comes to learning. Okay, so note that this one does not apply to students who are simply socially maladjusted unless a deeper emotion disorder is diagnosed. Okay, okay, for people who have schizophrenia, as hallucination, disorganized thinking, it actually affects the way they build relationship or express them or express appropriate emotions. For someone who hallucinates, it can be hard for that person to have relationship with people, and which can also affect that person's livelihood or the person's that person learning. Because for someone who hallucinates, can actually yes, we actually have trust issues, because the person is seeing what's not there. So if anybody comes close, you'll be thinking, this thing is there and this thing is not there. Okay, so this a few of them. Wow, our time has far gone, and I'm just in number 5. We're supposed to talk about 13. Okay, number 5, we have intellectual disability, short for ID. Number 5 is intellectual disabilities. Pardon. Significantly below average intellectual functioning with deficits in adaptive behavior. Examples such as social skills, self-care, appearing during the developmental period. Examples of intellectual disability are Down syndrome. Okay, I'm sure most of us know what's Down syndrome. It's actually a genetic condition which affects intellectual and physical development of an individual. So people with Down syndrome is easy to know, because with the person's appearance, I wish I had a picture here, but I don't have a picture. For so there's always like one deformity or the other in the usually most times it shows in the face. When you see someone that has Down syndrome, it shows physically on the face. Sorry, I don't have a picture. Yeah. So these learners benefit from structured environment, visual support, and life skill training alongside academic supports. So people who have Down syndrome, they're actually very brilliant too, but they have learning disorder too. Because I think I have, if I'm not mistaken, yeah, we have one in class, and she's brilliant. She's brilliant. She's compassionate. People with Down syndrome are actually very compassionate. When she comes into the class in the morning, she goes around and hug everybody, telling them good morning. So most times in class, we teach our learners skills to say good skills, greeting skills. But with her, when she comes into the class, she knows that she goes round. Nobody, we didn't tell her. She just decided by herself that okay, yes, that she wants to greet. So she just comes, very compassionate and very intelligent, very smart, very lively learner, and she greets everybody. So this particular disorder doesn't stop them from learning, but just like every other learning disability, they require special attention and special strategies too when it comes to learning. Okay, number 6, speech or language impairment. Speech or language impairment. So it's a communication disorder that affects a child's ability to speak, understand, or use language effectively. And examples of speech speech or language, excuse me, speech or language impairment is articulation disorder. So when we say articulation disorder is when it comes to like the pronunciation of words, such learner finds it difficult to pronounce words. For example, saying rabbit as wabbit. So there's a difference when a child is learning to talk. Let's say a child of 1 year old, a child of 2 year old, yes, you can hear these kind of things from them. Maybe when it comes to pronouncing somebody's name, the first letter will change or the last letter will change. But for a learner who is old enough to speak, but the words are not clear. For example, as like for the example I've given, rabbit for wabbit. Such a learner has articulation disorder. And another disorder is fluency disorder. That's stuttering or even speech reading. Another one is language delay. So this particular language delay is very common with children who have autism. Yes, children who have autism because they struggle with understanding grammar, vocal words, vocabularies, or forming sentences. So people with speech or language impairment, speech or language impairment, they mostly suffer language delay, just like the first example I gave, articulation disorder. The child may be of age to speak, and then such a child is not speaking, or maybe the child is okay, let me use another example. Maybe there are some words that a child is supposed to understand at a certain age. Let's say a child of 5 years old, a child of 6, okay, let me use 7 years old. At least for some certain extent, the child should be able to hold like basic conversations, request for basic things like I want water, hold a conversation with their mate, request for things, ask for I want to play. But if when a child is at that age and is unable to carry out these words or such activities, the child is said to be, or the learner is said to be, that they have learning delay, or sorry, language delay. So they find it difficult in forming sentences, just like I've said, requesting for things like I want to play from their schoolmates or from their mates, or requesting for things that they need. A child of 5 years old, if they need, let's say for example, they want biscuits, they should be able to request for biscuits instead of throwing tantrums, that's crying, falling on the floor and rolling. They should be able to say, oh, I want biscuits, without throwing tantrums. The child can still throw tantrum, probably maybe you said no, But this one, the child just saw biscuit and start crying, and then the child is not requesting for it or not asking for it. The child has language delay. Okay, number 7, hearing impairments. Hearing impairment is a hearing loss, whether permanent or fluently, that affects educational performance, but it's not classified as deafness. That's partial deafness or hard of hearing. So this particular disability is the person is not deaf, the person still hears, but most of the time they use hearing aids to hear. So the person may hear partially but not completely. The person, as said before, that the person is not classified under deafness. So there are hearing aids that the person uses and still is able to hear, unlike being completely deaf. So this particular hearing impairment, the person hears, but if you notice, there are people that when you are talking, they want to come close just to hear what you are saying. It's not their fault. And most people will misunderstand and be like, why do you always come close when I'm talking? Can't you just give the space? Because there's this thing we teach our learners: personal space, personal space. And when you notice that someone is always coming close, coming into your space and just to listen, to put their ear, just for them to listen to the conversation or to hear, it's very important that we as individuals, we understand, just we are different, everybody is different. So understanding that, oh, this person might have hearing impairment, that's why. So we can make excuses and accept them into our circle. Okay, number 8. Let me try to finish up. Number 8 is deafness. Okay, this is where we have where you can say is the person has total hearing loss. Deafness is a profound hearing loss that impairs the processing of linguistic information, with or without amplification, impacting education. Okay, yes. So as we the number 7 says hearing impairment, and we say it's not total loss of hearing. The person still hears, but partially. This one is deafness. Has lost um the person has loss of hearing. So the person who has total deafness cannot actually benefit from hearing aids. In hearing impairment, the person can benefit from hearing aids, but with deafness, the person can't benefit from hearing aids. So this is where sign language comes in. So because the person can't use hearing aids, the sign language can be used to communicate with that child or with that learner, in order for the learner to understand. So there are schools there are special needs schools that actually accommodate such learners. So if they are in an environment where sign language is not used, they are also taught to read lips. Like when someone is talking, they will stare at the person's lips so that they will understand what the person is saying. So they understand from when the person is speaking. So sometimes when we notice that we have such people in our environment, we try to, for people who are fast talkers, we try to reduce the speed when we talk, or use more of repetition, use words that they can actually understand. So yes, sign language is very important, because when people who have hearing loss, as I've said before, they can't use hearing aids. So the use of sign language is very important. And they can go to school, they learn just like every other learner. They have schools that can actually accommodate them. Number 9, deaf blindness. So this is a combination of the two, where someone has an impairment in hearing, that's deafness, and also inability to see. So deaf blindness is a combination of hearing and visual impairment that causes severe communication and developmental challenges requiring special education services. Okay, yes. So for people who have um both disability, that's hearing and seeing, it's yes, there are people in there, we have such people in our community, which there are also schools for them. And when we have such people in our environment, it's important that we accommodate them, we accommodate everyone. But just like I've said before, there are schools that actually accommodate such special cases. Okay, for these learners, they often require specialized teaching strategies, tactile communication method, and individualized support teams. So they have their own learning method, learning strategies that can be used to learn. I've I myself have not been to a school of the deaf and blind, but I know there are schools like that. And then their own teaching materials, learning materials are different from the regular schools, or the other ones that don't have, the schools that don't deal with the blind and deaf. As I've said before, I've not been there, but from the information that I've gathered, there are schools for them. Okay, time is fast spent. Okay, number 10, we have the orthopedic impairment. This is a severe physical condition that adversely affects educational performance. It may be okay. Okay, for example, this orthopedic impairment, an example of it is cerebral palsy, which affects a person's motor control and muscle coordination. So if you've come in contact with someone who has cerebral palsy, e the person has a problem with, such an individual have problem with their bones. For example, a child that is old enough to walk, you see that the child is not walking, or the individual is not walking, because the bones are weak to actually carry that person. So most of the time they have special chairs for people who have cerebral palsy. They still function well, they still go to school, they still learn. As I've said, there's no individual that cannot learn. It's just that we all have different ways of learning, we have different strategies in teaching people, or in teaching people who have disabilities. So because they have problem with their muscles and all that, that doesn't mean that they cannot learn, or because they're always in their special chair, that doesn't mean that this learner cannot learn. There's no child that is an abandoned project, because most educators will be like, oh, this child cannot learn, this child is there's no need in teaching this child, because what will the child use the learning to do? Which is a very wrong concept, as educators and as parents, as we in the general public too. So another example of orthopedic impairment is amputation. So amputation is we all know what amputation um is when, let me use lemon English to explain. When sorry, try to okay, resulting in mobility issues. So for people who have one amputation problem or the other, it could be due to an accident or due to an injury where the person's leg or arm, whatever, has to be amputated. These people still learn. These people still, we see them in our community almost every day, when you go outside, you see someone using crutches or on the road and all that. It's because of the way the society is. For those people who are actually meant to be helped, they are not meant to be on the road begging. They're actually meant to have their own special schools where they can learn, where they can learn to support themselves. There are ways that you can teach them others. There are skills that they can learn in order to support their livelihood. Okay, so such individuals use wheelchair, braces, etc. Number 11 is multiple disabilities. Okay, for short, because our time is fast spent, I'm going to try to rush into it. Multiple disabilities. This is when a learner has more than one disability. For example, when a learner has autism and ADHD. So you see a learner who has autism and then ADHD. So when such a learner comes to an environment and then we see just signs of autism, we'll be like, oh, okay, we can work on this, we can work on that. And then you now see that the child, oh, this child is also hyperactive. Oh, this child is also, you start noticing signs of ADHD. Okay, yes, so it's possible for a learner, for an individual to have more than one disability. And it doesn't have to be just autism and ADHD. It could be ADHD and dyslexia. It can be anything. Okay, because of time. A child with intellectual disability and cerebral palsy requiring communication devices and intensive therapy. Okay, yes. Just like I've said, it doesn't only it's not only autism and ADHD. There's also then intellectual disability and cerebral palsy. So such learners, we need um special devices and also therapy which will help the individual in areas of development and also in place of learning. Okay. Number 12, which is second to the last. Remember I said I was going to talk about 13 of the IDE learning disabilities. So this is the number 12. Visual impairments, including blindness. A visual impairment that's even with correction like glasses affect a child's learning, which include partial sight and blindness. So visual impairment can be low vision, just like when we have hearing impairment, visual impairment too. A child or individual, a learner can have low vision, which can also result in difficulty in reading and then learning or looking at seeing things from a distance or looking at small prints. So when such a learner or such an individual is in the classroom, or it doesn't have to be in the classroom, as I said, this is for general public, it's not just for educators, also for parents, it's also for general public, it's also for whoever is interested in helping people who have disability out there. So for example, in the classroom, if a person has low vision, if the person has visual impairment, you don't put such a learner at the back. It's going to be more difficult for such a learner to see um the lesson or see whatever is being written, especially in classrooms where they use board. So such a learner will be in front of the classroom, not as punishment, because most people feel like sitting in the front is punishment. When you go to a school, you see when they say pick a seat, you see learners going to the back seat to go and sit, or the first front row, nobody wants to sit in it. So people who have visual impairment, front row is best for them. It's not punishment, it's actually good for them. So they will see better They're able to understand better. Okay, yeah, they'll be able to understand better. So sitting in the front row or making their work, printing their work in bigger prints. There are also corrective glasses that they can use, that such learners can use. Okay, last and not the least, traumatic brain injury. Traumatic brain injury, that's TBI. This is an acquired injury to the brain caused by an external force, leading to partial or full disability that affects learning, cognition, memory, or behavior. Okay, there's actually I had someone when I was in secondary school. I had someone in my class who actually had an accident, and the person started having seizures. That's after the accident, she was healed and all that. She started having seizures. And when she was explaining to us, was like, after the accident, she had a brain injury, and which was now causing her to have such seizures. So this brain injury can occur from accidents, when someone have car accidents or fall or assault. Yes, so this thing, brain injury is sorry is caused by when a person have an accident, and then maybe there's a severe hit to the head, can actually cause brain injury, which affects this individual from learning. Some of them even lose their memory sef, and they have problem with regulating their emotions. So unlike most of other categories, this is not congenit congenital. It results from external trauma and often requires cognitive and emotional rehabilitation. Okay, so we can actually support these individuals. For what we did with my classmates then, we tried as much as possible to make the environment conducive for her, because sometimes she doesn't like noise. So we try as much as possible to reduce the noise that we make in the class, or just for some of us that understood and we cared, we tried as much as possible just to make everything conducive for her and give her space. Okay, so these are the 13 categories. As I've said, I didn't follow them. I just mentioned them randomly, and I just explained them randomly. So you can still go back and read on them. It's actually interesting. You see things that you never thought they're part of learning disability, and then you'll be amazed on what you can find. So please go ahead, do more research, and please bring in your question. This is the end of the class. This is the end of the class. So in my conclusion, I say, why does this category matter? Each of these IDE categories reflects the diversity of challenges students may face, but they do not define the potential or worth of a child. But they do not define the potential or worth of a child. Just like as I've been saying before, just because a child or a learner or an individual has this disability, that does not define the worth or the potential of that child, or what the child can learn. Every child can learn. I strongly believe in that. That's one of my motivation for going into this career path, special education. I believe strongly that every child can learn, no matter their disability. It's just using the right strategies, the right materials, the right IEP. It's by the time we understand our learners and how they learn, we'll be able to teach our learners. I believe that education is very important, And that just because an individual has one disability or the other, that doesn't mean that such individual cannot learn. Such individual can learn. So the goal is to ensure equity in education by recognizing needs and providing customized support. As educators, parents, advocates, guardians, it is essential, it is important to understand this classification, not just for eligibility but for compassionate, inclusive teaching. So just as I've said, the general public, if you are not into the space of teaching, you can be with the knowledge that you are gaining, with the knowledge that you have, it will help you to be more compassionate when you see these people outside, when you see these learners outside. Because believe me, they are now that special education is becoming more, the awareness is coming out, people are now learning more of it, and then we and then with we know having this knowledge, we'll be more compassionate towards them. Unlike before that, people don't even know what was going on, and then even teachers were making things worse by calling such a child names. So it's very important, and those of us that are interested in this learning, we are grateful and we say thank you for all you do as special educators out there and as parents who have special needs. Thank you very much, because when a child is being as a parent, when a child is being diagnosed with learning disability, can be a very difficult time for such parents. So we, the general public and those who are not in the space, with these classes, with this learning and teaching, we be able to be more compassionate instead of bullying such children, because most of these children, we may not know, they actually get bullied in school. Children who are not in the space of special education, or where awareness, inclusivity is not being practiced, such special needs children get bullied in the classroom. So it's important that even parents who don't have special needs children um create awareness or tell their children that, oh, when you see these cases, this is it, or it's not time for you to start bullying. It's because the child is vulnerable, because this learner is vulnerable, that doesn't give you the right to bully or call such a learner names. So thank you very much. Thank you for your attention, thank you for being here, and I I look forward to seeing you in the next class. Thank you very much. So please ask your questions, contribute in any way that you can. That's if you have anything else to add to what I've said, please bring it in, and I'll try my best to answer your question and also acknowledge your contributions. Thank you very much.
Okay, thank you so much, Ms. Lagila. That was a wonderful and a promising one. I personally, I learned a lot. I don't know about anyone else. I learned a lot, and I hope that every parent out there, every teacher out there is going to uh, apply what they have learned today. You know, knowledge is power, but what you do with the knowledge is what really matters. What you do with the power that the knowledge gives you is what actually matters. Thank you so much, so much, so much. And to you that is listening, I want you to know that we help these kids who are disabled, who have, we call them special need. They have special need. Okay, we help them to grow, to strive in society. So if you have a kid that is having this kind of special need, any of the special need being mentioned, please, we are here to assist. You can just comment on the section box, or you know someone you can recommend this video to go and watch in order for them to gain the knowledge that they need in able to deal and manage the child special need. This is very important. This is the school of the essence, and every Sunday we bring you all a special need class that is going to elevate you and edify you and also inspire you to understand how these needs are being managed, because it's not just like Miss Laila said, you don't bully a child, started calling the child names and everything because the child has a special need. No, you are doing it wrong. Okay, you're doing it wrong. You are doing it in the wrong way. So we are here to help everybody to understand and create awareness. Trust me, it's not everybody know that these things are out there. It's not everybody that knows. So that's why we, just like she said, most of these kids are being bullied. Most of them are being mistreated. Most of them are not being treated like humans. They feel like something that is wrong with them. I've seen cases where a child is suffering from autism. They have taken this child to many different soothsayers and many deliverance center for them to they feel is demonic. It's the
Wow.
problem of the brain. It is problem of the brain. So if you don't understand it, you think. And funny enough, they take the child off. No solution. There was no solution. The soothsayers and the deliverance center has been consuming the family money. No solution. There was no progress and everything. So they
Exactly,
have
because that's not the right method.
yeah.
These children needs special attention. They need intervention. And see, believe me, the earlier the intervention is started, the better. Because early intervention when it comes to special learning, special education is very important. It determines the level of progress that that learner or child is going to make. So taking that child to one deliverance house, I'm not saying that people should not pray for their children. Of course, it's important that that prayer is being made for them, but at the same time, the right channel too is very important.
Yes, they need that love. In fact, this is when they need it most. This is when they
Yes.
need it. This is when they need it most seriously. So thank you so much, Ms. Laila, for always educating and impacting us with this beautiful knowledge. And the school essence is out there for you that is listening. And we do this every Sunday. So always tune in every Sunday. Look out for our posts, comment, share your experience. If you have someone who is having this issue, so that we can also help to create this awareness around the world to show people that hey, this thing is real and this is how to do with it. We create the awareness, not just creating awareness, we provide solution too. Okay, very, very important. So thank you all so much for tuning in. Thank you all so much for listening. We are going to see you all next week. So if you have not subscribed to our channel, do well to subscribe to our channel because our channel is one of the best channel out there that you should be subscribed to. Very, very important. So love you all and see you next Sunday. Bye. Thank you, Miss Laila.
Bye. Thank
Bye.
you, Sabine. See you next Sunday.
See you next Sunday too. Bye.
Bye bye.